Welcome to Breaking Barriers, where we're exploring African American history and today's social justice issues. Change starts with awareness, so listen and learn. I'm your host, Stephanie, and let's get started. Hey y'all, welcome back. If this is your first time here, hi, my name is Stephanie Cooper. This is Breaking Barriers, a podcast about African American history and contemporary social justice issues. If this is not your first time and you are coming back, thank you so much. I love you. Thank you. So happy to be here as always. I'm grateful that you're here. Today's topic is going to be Black maternal health. So let's get into it. So as always, we are going to start in history. We're going to move through history, and then we're going to see where we are now and what got us to be here where we are now. So yeah. We're going to start in slavery area and then post-emancipation and kind of see where that got us and then go from there. So during slavery, Black women were denied access to any type of healthcare. So this severely impacted their maternal health and infant health. So like how their pregnancy is going, how their delivery occurs, the health of the mom during delivery and during the pregnancy, and then the health of the baby during delivery, after delivery, all of those things. These are a lot of things that are affected by access to healthcare. Having no access to healthcare causes a lot of concern. Having little access to good healthcare causes less concern, but still a high concern, something that we are currently seeing now. So post-emancipation, Black women still, and this is also affecting Black families, continue to endure poverty and inadequate access to healthcare. This lack of access to care created generational inequities that impacted health outcomes. So in the early 1900s is where we're seeing this growing concern for maternal and infant mortality rates. Again, this is excluding the Black community. This is just an overall concern, but again, the Black community is not involved in this area of concern. They're kind of not addressing the Black community, and it's really solely based around the white community. Communities are excluded from healthcare advancements and medical care and public health initiatives. They're not really considered when they're making these advancements. So they're thinking about, oh, what could we do better? How can we address certain things? How can we avoid certain outcomes? They're not considering the Black community. This is solely based around the white community. So limited access to healthcare services and systematic racism continues to perpetuate the disparities that we're seeing in the Black community. Then we get to the mid 1900s and some public health programs emerge, yet again, continuing to exclude the Black community. So this continued segregation and discrimination towards the Black community in healthcare settings leads to the disparities in outcomes as far as Black mothers and infants. So then we get to the 1960s. This is where we're seeing the civil rights movement, and this is kind of where we're seeing a boom in advocacy as far as addressing the inadequacies in healthcare when it comes to the Black community, when it comes to Black mothers and Black infants. Now we come to current day. We're seeing in the late 20th century to present that Black mothers, Black infants, Black babies, Black families overall are still facing disparities in healthcare settings. Despite the amount of advancements we've seen in the medical field, we're still seeing these inequities addressing the Black community. Black women continue to experience higher rates of complications during pregnancy and childbirth, and Black infants also face significantly higher mortality rates than infants of the white community. There are honestly a lot of factors that go into the inequities that we are seeing as far as Black maternal health and infant mortality rates, which include socioeconomic factors, and access to quality care, and implicit bias within the healthcare systems. So let's talk about current maternal and infant health disparities because there's a lot of numbers to back up the things that I'm saying to address, there is an actual area of concern. There is problems that we are facing in the Black community. So Black women in the United States are approximately three to four times more likely to die from pregnancy related causes compared to white women. According to 2022 CDC data, the maternal mortality rate for Black women was 69.9 deaths per 100,000 births. That doesn't sound like a lot now, does it? But let's compare it to women of other communities. Compared to 26.5 deaths for white women and 24.1 deaths for Hispanic women. That 69.9 sounds really high now compared to the 26 and 24, does it not? Yes, out of 100,000 deaths, that doesn't seem like a lot, but compared to other communities, it's a lot. That's a lot. And to think about how many babies are born a day, a lot. A lot. Like what? That's a really high rate. Mm, okay, let's continue forward. Disparities persist across income and education levels, underscoring the role of systematic bias and disparities in healthcare quality. Now, if we talk about infant mortality rates, Black infants are 2.3 times more likely to die within the first year of their birth than their white counterparts. 2.3 times more likely to die before their first birthday. The infant mortality rate for Black babies is 10.6 per 1,000 live births, compared to 4.5 deaths for white infants. That's more than double, meaning Black babies are 2 times or more, as we just spoke about, more likely to die than white infants. That's really sad. That's terrifying. That's very scary. Leading causes of infant death are premature birth or preterm birth, low birth weight, and complications from congenital conditions, which is often exacerbated by inadequate prenatal care and social determinants of health. So, not having the right level of care to begin with, as far as your health and being pregnant, is a contributing factor. Not having what you need through your pregnancy is going to lead to birth complications and the likelihood of infants dying. But because the Black community is often excluded from quality healthcare and even advancements in the healthcare system are not considering the Black community, is leading to infant mortality rates. On top of other areas of our lives where we're dealing with systematic racism, like in my last episode where I talk about environmental racism, these are social determinants of health. We're seeing food deserts and people living in areas of high pollution. These are things that are causing health issues that cause more issues in pregnancy. These are issues that people are already dealing with, but now because they are pregnant, it's even more concern. And they're not getting the quality prenatal care that they need to address these concerns. If they were getting this quality health care, these concerns that they may previously had. Maybe they had diabetes before. Maybe they had um, other types of concern that could cause issues for pregnancy. They could have been addressed, and mom could have been getting the right medication she needed or taking the getting the right prenatal care needed to address these things before the birth of the child, because these are things that are impacting the child. Some of the biggest current challenges that we are facing, um, honestly, there's a lot of them, but I'm going to start with one that really gets under my skin, that really, 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 really irks my nerves. Implicit bias. I didn't mean to do that. Everyone has bias. That is 100% fact. I don't care who you are, how righteous you think you are, how good of a person you think you are. I think I'm a great person, but I know that I still have bias. Everyone has some level of bias, plain and simple. Implicit bias are those biases that we may not even realize that we have. It's something that we may not even notice. It's something that we don't even think is an issue because no one has addressed it. This is one of the biggest issues that is facing the healthcare community. Plain and simple. So these implicit bias that we are seeing in the healthcare community are coming from our history. Starting with the fact that for some reason, this was very common in the healthcare field. There was this idea that Black people don't feel the same level of pain as white people, that we're just stronger and that we don't really feel pain. Like I don't know, that doesn't make sense to me. I don't know about y'all, but that really makes no sense to me. Like, we're all human. We're all made of the same type of stuff. I just got more melanin than y'all. And I don't even got that much, sadly. I wish I had more. I mean, it's wintertime, so I'm a little bit light right now, but I just want to know where that idea came from. Who thought that was accurate? Who came up with this? Who was like, yeah, Black people, they stronger. They don't feel pain like we do. Who taught you that? Okay. Anyways, regarding that implicit bias, Black women report feeling dismissed or ignored by healthcare providers. And this leads to delay, delayed care, delayed diagnoses, and delayed treatment. If you work in the healthcare field and someone tells you they are in pain or something doesn't feel right, listen to them. They know their own body. They know if something does not feel normal, something doesn't feel right. Listen to them. Hear them out. How much of your time and effort is going to take for you to at least run that extra test? So you know what? Oh, you know what? Let me check this. Let me check that. It's going to take 5 minutes of my time. I understand that there are prices that factor into all of this. I understand those tests are not cheap. All these things are not cheap, but I would rather that than this person continue to be undiagnosed or die because you didn't want to put that extra effort in. Because you don't want to listen to them when they told you something didn't feel right or they didn't feel good or they're in pain. Okay. I know multiple Black women who, when going into delivery, were fully prepared to have regular birth and then ended up in an emergency C-section because something was not addressed. Because they had mentioned a pain that they were feeling or something that didn't feel right to them. And it was addressed at the last minute because the doctors thought that they were all knowing and right. No. If someone tells you, whether you are a nurse, a doctor, whatever you are, if someone tells you something does not feel right, listen to them, hear them out. At least ask them questions about what they're feeling was wrong. Don't dismiss them and just ignore them or be like, oh, that's normal. Address it. Even if it is something normal, even if you're like, you know what, that's very common. Check it out to make sure it's not something of concern. Like, come on, y'all. Do better. Truly do better. This is a big reason why people don't feel comfortable in the Black community to go to the doctors. They don't feel safe to go to the doctors because they know the doctor does not listen to them. They don't feel heard, and then their symptoms are exacerbated by the fact that they're not being addressed. Another current challenge that we're facing is access to healthcare, and access to quality care. So, contributing factors to this are geographic and financial concerns. These are barriers that continue to limit access to quality prenatal and postnatal care, particularly in rural, all right, and underserved urban communities. Okay. So, because someone is under the poverty line or isn't close by high quality care, plain and simple, they just don't have access to it. That's it. Plain and simple. There's something that people try to do, there's nothing that people make an effort to push for to help people get to where they need to be. As healthcare workers, as nurses, doctors, whatever you are, your goal should be to help as many people as you can. You went into this field because you genuinely want to help people, enjoy people. Uh, Normally, that's why people go into healthcare field, because they want to help people. They care about people, and they want the best for them. So why not do more to help them get access to these things? Okay. Okay. People don't have access to things because they can't afford it. People can't go to the doctor because they don't have health care. People can't get the medication that they need because they can't afford it. They don't have access to this level of care. Why is more not being done to help these people? You know they need these things. You know they need this medication. You know they need this type of care. Why are we not working harder to find ways to serve these people? They deserve just as much level of care, quality of care as anybody else. Okay. Another current challenge we're facing is pre-existing conditions. Um, so very common high rates of conditions like hypertension, diabetes, and obesity, um, seen in the Black community, can increase risk in pregnancy. Again, these are all issues due to um, environmental factors, social determinants of health that are causing these health issues. Obesity, food deserts. We don't have access to healthy food that is affordable. People are buying what they can, which is leading to obesity and diabetes. Obesity and diabetes are coming from other social determinants of health, environmental racism, not having access to healthy, nutritious food that is good for the body. It's not affordable. It's not in the area that they live in. There's many reasons as to why. Having unhealthy foods is leading to these health conditions that are causing extra concern or higher risk in pregnancy. Um, I talked about last video, environmental racism, quality of air, pollution. All these things are things that lead to um, pre-existing conditions that cause more concern for pregnancy. Challenge that I want to talk about is postpartum, or just mental health in general, but postpartum depression and anxiety remained a underdiagnosed and undertreated condition in the Black community, Black mothers specifically, but it's due to stigma and inadequate mental health resources. I have talked about this in a previous episode, talking about mental health in the Black community. Mental health in the Black community is unfortunately something that is very hush hush. We don't like to talk about it. Um, we feel like there's a need to put on this front to be, especially as women, strong Black woman who does everything by herself, is good, she got her own, all these things. But mental health can affect anybody. I don't care if you're blue, purple, orange, yellow, black, white. It doesn't matter what you look like. Mental health can affect you. There's factors in your life that lead to this. Um, Plain and simple, is going to affect your life. Whether it's you, someone you know, family member, spouse, anything. These are things that can affect anybody. And postpartum is one of those things that it can be very, very minimal, but it also could be very, very extreme. I think it's something that is more commonly spoken about, like on social media nowadays, but it's something that definitely needs to be addressed because postpartum can develop into something very scary. Like there has been stories out there of women who kill their own children because of postpartum depression. People who may not have the best relationship with their child, or they feel like they hate their child because of postpartum depression, and they are upset about it, or they can't understand why they feel some type of way towards their child. And postpartum and anxiety are leading factors in this. They are the reason that is they are feeling these types of feelings, and them going unaddressed only causes more issues. So keep that in mind. If you are pregnant, you are planning to become pregnant, you know somebody that's pregnant, keep these things in mind. Think about this, after they give birth and they, how are they feeling? Check in on them, make sure that they are okay, make sure that they have everything that they need. Um, they may not always need, more diapers or whatever it is. Maybe they just need someone to check on them. Like maybe they need someone to come over and help them clean because they haven't had the chance to clean, or they need someone to come over and help them cook. Like whatever it is, check on it. Don't just, be like, "Oh my God, can I see the baby? Can I see the baby?" Check in on mom. Make sure she good. Because sometimes she's not always good. Sometimes she just need a break. She needs to take a nap. She needs to eat. She hasn't eaten all day. Um, just keep these things in mind. And it's something that needs to be addressed. So if you know somebody, you feel like they're dealing with postpartum or really bad anxiety after giving birth, help them. Um, Help them find resources for mental health and addressing the concerns that they are facing, because it is very serious, and it definitely needs to be addressed, especially in the Black community, because we don't talk about mental health as much as we should. So I just want to talk about addressing maternal and infant health disparities and what we can do to make a change. So starting with improving access to quality care. With improving quality care, expanding insurance coverage. So increasing access to comprehensive healthcare, not just the basics, something that is going to cover all possible areas of need, including Medicaid expansion and postpartum coverage for at least 12 months after birth. Those first 12 months are very important. As I talked about earlier, the likelihood of a Black infant dying before their first birthday is extremely high. So making sure that that quality of care is there and available to them for at least the first 12 months is essential. Also increasing healthcare providers. And on top of that, increasing the access to unbiased healthcare providers, specifically people of color. I know that I'm going to feel way more comfortable if my doctor is Black. Like, and that's not to be, like secluding or just like saying that white doctors aren't good enough. It's just, I know that that Black doctor, chances are it's more likely they know what I'm going through. They've probably been through it. They get it. They're not going to judge me. They're not going to dismiss me. They're going to take everything I say into consideration because they understand the community that I come from, because they are also from it. You can't get access to Black doctors or a doctor of the same race as you. We need to recruit and train quality, quality cultural competency. This is something that needs to be practiced in all areas. Honestly, all fields should be training people in cultural competency. This is something that is very, very talked about in the social work community. Like, we make sure that through and through, we got our cultural competency training on deck because we work to serve all communities. So making sure that we are knowledgeable about different communities is essential. So making sure that our healthcare providers are also knowledgeable about different communities is very important. Making sure that, what, I do know that this condition or this disease is more common in the Black community. Maybe this is something that I should, consider. Maybe we should do testing to make sure that this is not something that this mother or this child is possibly facing. Having that knowledge to address possible concerns, or the knowledge to be like, what, she's telling me that she's feeling this type of pain. I have seen this before, or this is common in the Black community. Let's address it. Let's take some time to address concerns, whether it's asking more questions, running tests, doing whatever it is that needs to be done. Care should be supportive and personalized. Personalized. Like I said, if this is something that a doctor or nurse, whatever, is seeing that is common in the Black community and someone is expressing this concern, address that concern, but make sure that it is personalized to that person. Make sure you are addressing their specific concerns. The things that they are saying to you are their concerns. Address them. Yes, you may have seen this before, but did this person also have this pre-existing condition? Is this person the same age as them? Is this person all of these things? Are they having the same amount of children? Whatever it is, do they have the same pre-existing conditions? Personalize it and make sure that you are addressing their person for who they are, what they are going through, what they are dealing with, pre-existing conditions, their age, their gender, all of these things. All of these things are contributing factors, regardless of maternal health, in general healthcare. Personalizing support for each person is important. The next one is enhancing prenatal and postnatal care. So creating comprehensive programs, developing initiatives that are offering regular checkups, screenings, and education for pregnant women. This is really important. Yes, we have access to the internet now, so it's a lot easier to educate yourself when you are pregnant, or you want to become pregnant, or you're trying to become pregnant, whatever it is. You have access to the internet, so you can research these things. But sometimes you don't know what you don't know. You don't know what you're supposed to be looking up. There are basic things that you could look up and be like, oh, I know I need to know this or this. But there are certain things that you didn't even know that existed. You didn't even know that was something you needed to be concerned about. So having these programs that are teaching women all the things that they may encounter or that they need to know, even if they don't encounter it, it could be helpful for them in general. This also, having these checkups is really important. Getting all of the screenings that you need done, testing to make sure that there's no pre-existing conditions, or checking on the baby through ultrasounds and all of these things to make sure that everything is developing properly, that the baby is on track for all of its milestones that it needs to hit before giving birth. All of these things are very important. I have two other sisters who, have children, so they've been through this process, and we've talked about it where, they weren't getting as many ultrasounds as they were supposed to be getting. They were getting the very bare minimum, just the required, like 8 weeks, 16, 20, all these things, but nothing really in between. And the people that are getting them solely because they have pre-existing conditions, or they've developed a condition that is a high risk for the baby or high risk for the mother. But having this overall is essential for everybody, especially for women who are first-time mothers. Showing them, this is the level of care you should be getting. These are the things that you should be getting, the screenings, the tests, the checkups, all of these things, and educating them on why they need these screenings, why they need these tests, why they need to take prenatal medication or vitamins, whatever it is, why they're taking these things, and how it is affecting the baby that is developing in their body. Another one is doulas and midwives, so supporting the inclusion of them in healthcare teams. Um, these are something that may be really important for some people, and other people, they don't feel like they need it. This is again where that personalized support comes in. If someone, hires a doula or a midwife, and it is very important to them, and this is someone that they, trust with their pregnancy, they should be involved in their care. They should be aware of all the things all the screenings, tests, and medication that they're getting from their health care. If y'all know me, if you've seen my podcast before, you know I love policy. So I'm always going to talk about policy change. One of them being health policy reform. So pushing for policies that actually address systematic inequalities, including maternal health, um, infant mortality rates, and just overall health for pregnant women, mothers, children, addressing these areas and funding for community health programs. So, programs that are going to educate people to help them in areas of need, addressing things that they may have not gotten as far as their care due to um, many factors. Also, reproductive justice, advocating for equitable access to family planning, contraception, and abortion services. I know this is a very touchy subject, in especially in Texas. I live, in a state who very, very touchy about stuff like this. I'm from Connecticut, so this is not something that um, I'm afraid to speak about. These things should be available to women for many reasons. Say what you want, but my body, my choice. People have the right to do with whatever they want with their bodies, plain and simple. If you don't believe that, that's fine. That's my opinion. You have your own opinion, and that's okay. That's totally fine. Um, but there are many situations where um, women either weren't given the choice as far as having a child, or don't have access to take care of a child, or don't have the financial stability to care for a child and bring them into a world in a healthy way. Um, so having access to family planning, contraception, all of these things is really important. And not everyone wants to get pregnant. Why not everyone wants to have kids? Um, and some people end up in situations that they were not expecting, being pregnant through, someone attacking them, or through something that just was very unexpected, or that their life is at risk if they were to get pregnant or if they were to give birth. There are many different situations that people are put in that are, being pregnant or having a child is not the best option for them. So having access to these things is very important. And it's something that definitely needs to be addressed, especially in Texas. Lastly, this is really important, building community support systems. One of them being peer support groups. So, having groups where you can meet up with other moms or other new moms, developing groups for pregnant and postpartum women, just going to have a space where you can ask questions or talk about your concerns, or just have a break, just breathe and be an adult, be a woman, be who you are, because taking care of a child can sometimes take away from that. Like, you don't have as much time, or, your energy and time is going into that child. So just having a space to just be yourself and remember that you are a person at the end of the day, and you have a life as well. Your life should not revolve specifically and only around your child. You should also have a life outside of that. So having support groups for this is also very helpful. And also having mental health services, expanding access to mental health resources for new mothers in general, all of these women that are going through taking care of a child or having a child or carrying a child, and especially in like that postpartum area, addressing postpartum depression and anxiety, all of these things that you know is helpful to have support. You may be a first time mom, and or maybe this is your third pregnancy, but you never experienced postpartum the way that you feel it now. Having those supports and someone that you can go to and be like, hey, I'm not sure why, but I'm feeling this, this, and this. And having that comfort of them understanding, you know what, this is not your fault. This is, you're dealing with some mental health concerns. Let me, guide you to the right place. Go here, try this place. These are some resources that I used or I know that somebody else used to help them when they were dealing with the same concerns. Um, there's a lot of things that we can do. But as always, I will always say use your voice. Start local, start, in peer groups, start small, it's a lot easier to start small and then go from there. Um, so doing these things, using your voice and addressing those concerns that you are seeing in yourself, other people, friends, family, whoever it is, even if it's on social media, go use your voice, be a part of the change, make the change you want to see, be the change you want to see. And know that you are not alone. There are other people going through this. There are other people that may be dealing with the same concerns. You just don't know it. So talk to people. You will realize that you are not alone. That's all I have for today. Thank you so much for listening. I'm so grateful to have y'all here. I'm grateful to have this platform to talk about all of these different things and ways that we can make change. Please like, subscribe, comment, all the things, share. Yeah. Other than that, have a great day. Thank you so much for listening, and I can't wait to see you in the next episode. Thank you for tuning in, and we'll see you on the next episode.